Ever wondered why something as small as a boil can cause such big trouble? Boils or skin abscesses are infections deep in the skin that begin around a hair follicle or oil gland. Caused primarily by bacteria like Staphylococcus aureus, these painful lumps are filled with pus and can be quite tender to touch. Many experience them, and the discomfort can be significant, making it a condition that demands attention. So, if boils are so common, how do we deal with them effectively? Stay tuned. First things first. How do you know it's a boil? Imagine waking up to find a red, tender lump on your skin. At first glance, it might just seem like a bad pimple. However, a closer look reveals more. Unlike pimples, boils are larger, redder, and more painful. They start as hard, red lumps, then gradually become softer and more swollen as they fill with pus. Boils are essentially infections of the hair follicles, initially caused by bacteria, typically Staphylococcus aureus. These are not to be confused with cysts, which are closed sacs that can contain fluid or semi-fluid material, but aren't typically caused by infection. Recognizing the difference is crucial since each requires a different approach to treatment. The presence of a yellow or white tip at the center of a boil, where the pus will eventually drain, is a telltale sign. This distinguishes it clearly from other skin issues. Correct identification is your first step towards effective treatment. Now, let's explore some gentle warriors from your kitchen that can battle boils. First on our list is the warm compress. This simple yet effective remedy involves applying a warm, moist cloth to the boil for about 10 to 15 minutes, several times a day. This method helps the boil come to a head more quickly by drawing pus to the surface, thus speeding up the healing process. The warmth increases blood circulation to the area, bringing more white blood cells and antibodies to fight the infection. Next, we have tea tree oil, a potent natural antiseptic known for its ability to fight bacteria and reduce inflammation. To use tea tree oil on a boil, mix a few drops with a carrier oil like coconut or olive oil to prevent skin irritation. Dab a small amount of the diluted oil onto a cotton swab and gently apply it to the affected area. This can be done 2 to 3 times a day until the boil begins to diminish. Remember, tea tree oil is powerful, so a little goes a long way. Moving on to turmeric, this spice is not just for cooking. It's also a powerhouse of anti-inflammatory and antibacterial properties. You can make a paste by mixing turmeric powder with water or ginger and apply it directly to the boil. Alternatively, drinking turmeric mixed in warm milk or water can help boost your body's natural healing processes from within. This golden spice helps reduce inflammation and pain, making it a valuable ally in your boil treatment arsenal. Lastly, consider an Epsom salt bath. Epsom salt is known for its ability to draw out impurities and toxins from the body. For treating boils, add a generous amount of Epsom salt to a warm bath and soak for about 15 to 20 minutes. The salt helps to dry out the pus, allowing the boil to drain naturally. While home remedies can be effective, sometimes they might just not be enough. So when should you actually worry and seek medical attention for a boil? While most boils can be managed at home, certain situations require a more professional touch. If a boil develops into a severely painful ordeal, it's time to consult a healthcare provider. Pain is the body's signal that something more serious may be at play. Another red flag is a fever. This indicates that the infection might be spreading beyond the boil itself, potentially entering the bloodstream. Such scenarios need immediate attention to prevent more severe health issues. Additionally, if you're dealing with not just one, but multiple boils, or if a boil appears in particularly sensitive areas such as the face or spine, professional evaluation is crucial. These locations are vulnerable and complications could be more serious. Complications from untreated or improperly treated boils can lead to more severe infections or even scarring. Seeking medical advice not only ensures proper treatment but also prevents long-term damage. Remember, better safe than sorry when symptoms escalate. In cases where home remedies just don't cut it, medical intervention steps in. When boils become stubborn or particularly severe, a healthcare provider might recommend more advanced treatment options. Let's dive into what these might include and understand their purpose in the healing journey. Firstly, antibiotics are commonly prescribed when the boil is caused by bacteria that might be resistant or if there's a risk of the infection spreading. Typically, antibiotics are recommended if you have multiple boils, if the boil is located on the face or spine, or if you show signs of a systemic infection like a fever. These medications help to kill the bacteria causing the infection, thereby reducing inflammation and pain. Oral antibiotics are the most common form, but in cases where the infection is severe, intravenous antibiotics may be administered in a hospital setting. It's crucial to complete the full course prescribed by your doctor, even if the boil starts to improve, to ensure all the bacteria are eradicated and to prevent resistance. Now let's talk about surgical drainage. Sometimes a boil won't heal with antibiotics alone, especially if it has formed a large pocket of pus. In these cases, a doctor might perform an incision and drainage. This procedure involves numbing the area around the boil, making a small cut to drain the pus, and then cleaning the area. It's a quick procedure and often provides immediate relief from pain. After drainage, the area is usually covered with sterile gauze to absorb any additional pus and to protect the open wound from further infection. It's important to follow the aftercare instructions provided by your healthcare provider to ensure proper healing. For recurrent cases, your doctor might investigate other underlying health issues that could be contributing to the frequent boils, such as diabetes or other immune system disorders. Consulting a healthcare provider can sometimes be the quickest route to relief. In the battle against boils, combining professional medical advice with proper care can lead to a smoother and swifter recovery. Having tackled a boil, how do you make sure it doesn't make an unwelcome comeback? Well, prevention, as they say, is the key to keeping these painful nuisances at bay. First and foremost, maintaining good hygiene is your first line of defense. Regularly washing your skin with antibacterial soap can significantly reduce the likelihood of bacteria accumulating and causing boils. Focus on cleaning areas that are prone to sweat and friction, such as the armpits, groin, and neck. Next, consider your personal items like towels, razors, and clothing. These should never be shared, even with family members. Bacteria can easily transfer through these items, turning them into vehicles for potential infections. Diet and hydration also play crucial roles. A well-balanced diet rich in nutrients supports your immune system, fortifying your body's natural defenses against infections. Foods high in vitamins A, C, and E, as well as zinc, are particularly beneficial for skin health. Don't forget about hydration. Drinking plenty of water ensures your skin remains supple and less prone to breaks where bacteria can enter. For those prone to boils or who engage in activities that increase the risk, such as contact sports, consider using medicated body powder or moisture-wicking fabrics to keep the skin dry and less hospitable to bacteria. Remember, every step you take towards cleanliness and a healthy lifestyle not only helps prevent boils, but also supports overall well-being. Prevention is always better than cure, especially when it comes to boils. Let's boil it down to the essentials. Throughout this exploration of boils, we've covered quite a bit of ground. Starting with the basics, recognizing a boil is the first crucial step. Identifying that tender red lump early can guide you on the necessary steps to take next. Moving on, we delved into the world of home remedies. From the application of warm compresses to the use of turmeric, these methods can be effective for managing pain and encouraging the boil to drain naturally. However, it's important to remember that not all boils can be treated at home, which brings us to the importance of knowing when to seek medical help. If a boil becomes too painful, grows rapidly, or shows signs of severe infection, consulting a healthcare provider is essential. Medical treatments such as antibiotics or surgical drainage might be required. Lastly, we discussed prevention strategies. Simple habits like maintaining good hygiene and proper nutrition can go a long way in preventing future occurrences. Armed with this knowledge, you're now better equipped to handle and prevent boils. Remember, taking action at the right time can save you a lot of pain and trouble.